she was very transparent and honest. We had some tough conversations, and she was always willing to hear us and admitted certain things, right? She said, we have data, but we then have to create policy. And it's not easy to create one policy for New York City, for the Navajo community, for St. Louis urban city level, right? And for a rural setting. And so what that then means is that public health departments have to work on what is specific to their environment. And my plea, very specifically that was heard, was we need help and resources to be able to do that, especially for those of us who are underfunded and have smaller work capacities. And that's where some of the exciting dialogue, where they gave us immediate resources, some ideas about that, but also we were able to say we'd love to collaborate in the future. Yeah, I talked about workforce development because, again, public health departments have taken a hit, and I have the best staff in the country, but they are tired and they are feel undervalued. They feel, they get paid a lot less than people in the private sector. She understood that. The CDC has some resources that we'd love to explore, but it was a great conversation about, things that we could do in the future. We talked a lot about what's been working. President Biden cited St. Louis as one of the cities that's done a great job in partnering with trusted community partners. That's why it was important for me to make this opportunity available to our federally qualified health centers. And she got to hear the success stories. We've become so accustomed to always talking about what's not working. Today's a great day. Today, St. Louis is on the national map. We are being seen for the great work we do. And I hope that continues to increase morale, increase confidence, and increase opportunities for collaborations and other ways that we can get much needed resources to the city. But she was inspired. She talked about the spirit of our health department. She loved some of the unique ideas and things that we've been doing that they hadn't seen in exactly the same way. She was appreciative of feedback. She actually asked counter questions. We have one of the most robust partnerships with multiple different community partners in the city of St. Louis. She wanted to hear about how that was working. We had a great conversation about how community canvassers from clergy advisory boards were more successful than the ones we had at the city. Why? They're trusted. They're literally the congregations in their own communities. So how can we learn from that in future endeavors? So it was a great, great, great discussion.